Fluoride was initially put in the water really based on observation of a dentist out of Colorado who noticed people in his community had fewer cavities, and in hindsight we know it was fluorosis. So it's just sort of been grandfathered in as a public health movement because cavities were skyrocketing. But what really were causing the cavities, I would argue, it was our food. Our ultra-processed food, our sugary foods, our milled flours, refined flours, and how we're breathing. So it really was a Band-Aid approach. But now more and more data has come out showing that it has some neurotoxicity effects. And it really is, fluoride is really defined as a neurotoxin. And so this is really controversial and people get really heated up about it. But I do think to do no harm, we need to be looking at the data. And so there's now over 70 studies that are showing that by intaking too much fluoride in pregnancy and in infancy and early childhood, it can impact the IQ of children and their neurodevelopment. And it can affect, particularly boys, up to 5 IQ points, which doesn't sound like a lot, but it's actually on par with lead. And again, this is water fluoridation. So we also know through the research, fluoride really works topically, not systemically. And I will say, only 3% of Europe currently fluoridates their water. So 97% of European countries do not. Many of them have removed it from their water long ago for various reasons. One, the neurotoxicity concerns, but also the medical ethical concerns. We really are mass medicating people without their consent.
Hey folks, now today's show with Dr. Staci Whitman is brought to you by Myoscience Nutrition. As you can tell, we're talking about the importance of the oral microbiome as it relates to gut health and systemic health. It's a fascinating discussion. I hope you learn a lot. Now, one thing we do talk a lot about is the importance of counteracting fluoride in water using water filtration. One thing Dr. Staci mentions is iodine. Iodine is important to displace halogens in the environment, such as chloride, bromine, or even fluoride. So if you're not ingesting liquid iodine, I strongly suggest you consider it. We take this on family vacations. If you're drinking like hotel water, for example, or unfiltered water, you can take a little bit of iodine to help displace that. And also it helps as a natural antiseptic for when you're out drinking water, say backcountry camping or camping. Also, iodine is an essential nutrient, not just for thyroid health, but also for breast tissue health, also for the prostate, also for the ovaries. Many tissues throughout your body concentrate iodine. That's one thing to consider. We also talk a lot about vitamin D and vitamin K because they are very important for bone structure, for teeth health, and much more. And at Myoscience, we have the essential fatty nutrients that features both vitamin D as well as vitamin K2 in its MK7 form from Gnosis Biotech in Italy. It's one of the best vitamin K formulations out there paired with vitamin D. So you can save on liquid iodine as well as the essential fatty nutrients with both vitamin K and vitamin D over at myoscience.com. You can use the code podcast to save at checkout. So friends, this show is worth listening all the way to the very end. It is packed with amazing practical information that can change your health and possibly your life, especially if you have children. Far too many children now are breathing through their mouths. They have structural imbalances within their mouth, with their teeth structure, with how they're positioning their tongue. And the oral microbiome impacts systemic health. When it comes to diabetes, when it comes to high blood pressure, when it comes to erectile dysfunction, fertility, the list goes on and on. This is when we talk about root cause resolution of all these different diseases, this is up there at the top. So I really encourage you to share this episode with a friend, listen all the way through, check out the show notes. This is jam-packed with excellent information. Let's cut back to it with Dr. Staci Whitman. Well, Dr. Staci, thank you so much for coming out. I'm really excited to talk more about the airway health and the link between the oral microbiome and the gut microbiome. That's been a big focus of your work for the past 20 years. I would love to know sort of what got you as a mainstream trained dentist, what got you more interested in sort of this holistic aspect of dentistry, meaning how the airway connects with the function and structure of the face and the oral microbiome and how that connects with gut health and so forth. Like, was it a seminar, a workshop? Was it literature? How did you transform your career in that way?
Yes. Wow. All good questions. Thank you for having me, Mike.
Sure.
I'm a big fan, so this is an honor. My path has been a little convoluted, but essentially I lost my parents very early and started really looking internally at my own health and how lifestyle impacted that. So I was cleaning up my health and decided I needed cleaner ways to practice dentistry as well, and practiced very conventionally for many years, but just felt I wasn't moving the needle whatsoever. and I didn't have enough time with patients to unpack the root cause of their issues. So how do I get upstream? I go into pediatrics. So I thought I want to catch humans before things really turn into full-blown fires. So I did a residency in pediatrics. I worked as an associate and in academics for a while, but still wasn't feeling satisfied. And it took having to see my own daughter suffer from airway sleep issues to really send me down this path of not only holistic health, which I already was practicing to some degree, but also airway and sleep health, and how important it is to catch these things very early in our children to course correct, because we know sleep and breathing is foundational for optimal health. And so I opened my own practice where we focus a lot on nutrition, functional nutrition, but also airway health, and as you mentioned, microbiome health, which we can get more into, but basically how the oral microbiome impacts us systemically.
That's amazing. And if you could estimate the prevalence of disordered breathing in children and airway dysfunction, small mouth, all of that, is it 20%, 30%, 50%? Like, how common is this in children?
Yes, good question. There are estimates in some studies that up to 90% of children have some dysregulated breathing, and that patients with actual sleep apnea are misdiagnosed or missed up to 80% of the time. Wow. So I will tell you anecdotally in my practice, it's very rare for me to see a child that is coming in without some sort of either skeletal facial, craniofacial growth discrepancy or a breathing abnormality. They have some sort of sleep imbalance, sleep hygiene issue, or breathing dysfunction. So it's really, really common. It gets to be a bit overwhelming, but it is part of my passion is to really help these families unpack what can be a very overwhelming concept in knowing where to start. And so we know if we can address things early, in sometimes even in infancy, that we can course correct, and it can be a lot easier for the trajectory of the child to optimize growth and development and their hormone development, and also behavioral issues that can happen as they get older from chronic sleep deprivation.
That's so key. And it's really frightening when you look at the percentage of children that are now on stimulants or psychiatric medications, polypsychopharmacy, I think they call it, with regards to the use of all these different medications, trying to mask the symptoms of attention deficit disorder or depression, anxiety as a result of possibly sleep issues or all of that. I know a lot of people have sort of speculated, what is the root cause of this? Is it the lack of breastfeeding? Is it the microbiome changes? Is it all the soft processed foods that we're eating? I know James Nestor has talked a lot about this in the book Breath. So if you could, in your experience, and I know it's multifactorial, but if you could poke at one thing or a few things, what do you think is the root cause behind so many children now suffering from smaller airway and smaller mouth and all of the associated pathology?
Yeah, I love this question. It is hard to say it's just one thing. But if we look ancestrally from an evolutionary standpoint and looking back on when did this all go sideways? You know, you can look at the industrialized revolution, but then the agricultural revolution before that, and even the advent of fire. It comes down to chewing and mastication, and James speaks to this a lot in his book. But we just don't chew like we used to. It's estimated that ancestrally we used to chew up to 4 hours a day. And now with ultra processed foods and smoothies and pouches and soft mac and cheese and things of this nature, we just aren't chewing enough. And we do know that form follows function, and that in the battle between muscle and bone, muscle always wins. And so there is so much with facial development that happens through our tongue, which is a huge muscle, and how we're chewing and swallowing. And that does start, as you mentioned, with breastfeeding. So, you know, some families aren't able to, some women aren't able to breastfeed, but if you can, that is our biggest advice to get the ball rolling into optimal craniofacial respiratory development, because it is a complex. How our face and our jaws grow affects how we breathe. So you could argue it starts in utero, even by what you're eating nutritionally. And then how you are delivering your baby, what is their microbiome exposure early on. But breastfeeding certainly is a great way to start that facial development, that jaw development, assessing for tongue ties, of course, and then also making sure we're introducing real whole, crunchy, chewy food. So meats and vegetables, and not all of this ultra processed food too. Weston Price, many of us have heard of him. He speaks to this also, that we used to have large enough jaws to accommodate all 32 of our teeth, and now our jaws are shrinking. We're suffering from a lot of malocclusion or bite issues, crowding, and so many orthodontic issues, and that's affecting how we breathe and ultimately how we sleep. And when we aren't getting into our deep stage 3 sleep and we're not getting hormone release, we can have growth discrepancies, immune function issues, and that chronic sleep deprivation can lead to behavioral issues. And as you mentioned, so many children are now being diagnosed with ADHD and put on stimulants. And my argument is, if your child is showing behavioral issues, or if a teacher comes to you and says, I think your child might have ADHD, the first thing we should be doing is doing an airway and sleep screening on them, because a huge portion of these children, a huge number of them, have underlying issues that we're missing.
Yeah, that's really important. And you mentioned tongue position and how the tongue really helps. Is it the maxilla? It helps shape the maxilla?
Yes.
And in adults, is this bone malleable? Like, so there's a lot of adults who don't even know, when you say tongue position and you ask, where are you putting your tongue at rest? Most people have no idea where it is. Mm-hmm. How sort of malleable is this bone even in adults?
Yeah, that's a great question. This is up for debate. It's a big scholarly debate. And James will speak of this in that book, Breath, also. There are appliances now that are proving us wrong. We used to think you couldn't really change the shape of the maxilla or the craniofacial complex much into adulthood, but there's like homeoblock and bioblocks and other appliances that are proving us wrong. There's also other ways to expand using small TAD or screws in the palate that can expand, but all hope is not lost if you're an adult. But obviously we want to catch things earlier, because into adulthood, there's a lot of bad habits to unpack. And this is where myofunctional therapy comes in, and rebreathing therapy as well. And so we can orthodontically make a lot of changes in adults, but we like to catch things earlier, definitely in kids. So what we suggest parents look for, if you're saying, well, how do I know if my child has an issue? There are research studies out of LA at the Breathe Institute. Dr. Shrush Jaggi has created something called the Fairest 6 score. And there's a couple ways to assess if you think your child has an issue with the way they're breathing. And one is simply, can you or your child breathe through their nose comfortably for 3 minutes straight without feeling very panicked? If you can, then that's great. If you can't, then there might be a structural issue and maybe you need to see an ENT. But then dentally, we're looking for crowding or narrow jaws. And then also, if your child, if the only way they can close their lips around their teeth is they have, it's called mentalis strain. So it's dimpling of the chin. It means you're having to overexert these muscles around your lips, the orbicularis oris muscles. And that's showing that there is kind of some sort of imbalance between your jaws. But ideally, you want the tongue to be positioned kind of suctioned up at the palate, and that starts in utero essentially, and your tongue is this huge strong muscle, and so as it sits up at the top of the palate, the face spreads and we grow. The width of our face will expand, but what's happening either from tongue tie or just genetic predispositions, the tongue sits low, and so instead of a broad wide face, we're getting a long dolichofacial, or we call it adenoid facies growth pattern. So we're growing long and thin and not broad and wide. And that is affecting how we breathe. So your tongue does want to be suctioned up to the roof of your mouth. Ideally, the tip of your tongue behind your upper front teeth, and kind of suctioned all the way. And the bummer for a lot of adults is their palates are too narrow, so their tongue can't even fit up there. So even with myofunctional therapy, if your house for your tongue isn't big enough, then you're going to have some dysfunction. And so that's where orthodontics comes in. And there is a movement now that really we should be focusing more on changing the structure rather than just going right for surgery, let's say, like a tongue release or adenoids and tonsils out. And this includes with kids. We really need to be starting early interventive orthodontics, and that's part of my practice, is that we will refer kids sometimes as young as 2 or 3 years old to get things started. And this isn't for braces, this isn't for the Hollywood smile or straight teeth, this is to change growth patterns.
That's really important because it's affecting so many different facets of health, and disease predisposition. If you don't correct sleep issues, then you could have behavioral problems that can lead to food addictions or all these other things. So, we talk a lot about root cause resolution. And in my eyes, this is like one of the first things that we should focus on because we breathe, was it 6,000 times a day or some such thing? That's a lot.
It's a lot.
And if we're breathing improperly, and then we swallow a lot as well. And if your tongue is in the wrong position when you're swallowing, that's just exacerbating the problem.
Yes.
So yeah, it's exciting, but a lot of folks just want to know about, hey, what's the latest fat burner or the detox drink? And it's like, no, we got to focus on these.
Well, it's true. I mean, I say this, others agree. You can do as much resistance training. You can have the cleanest diet. You can even really prioritize your sleep hygiene. But if you're not breathing properly, you likely won't not have optimal health because it affects your microbiome as well. And some people just take breathing for granted. But what is the one thing we can't survive with for more than 3 minutes? It's oxygen. So it really is the most critical nutrient. And without it, I really don't feel that we can have optimal living. And especially where brain development is so important in kids. And what does your brain need? It needs a lot of oxygenation. This is really important to get under control. And I'm disappointed that so many colleagues just kind of kick the can, or they say that your child will outgrow it. And what we're just watching kind of children get sicker and sicker as a result. But I do see a movement happening in dentistry and even in medicine where airway health in children is becoming more discussed. And so thank you for giving me a platform to talk about it more. Parents often say, where do I start? I will say there's a wonderful book. It's called Sleep Wrecked Kids. It's written by Sharon Moore, and it's written for parents to become advocates for their children. So I highly recommend, if you're scratching your head saying, no one in my area practices this way, I can only get so much from a social media post. Where do I start? I really recommend getting that book. And then also for you as an adult, Breath by James Nestor is wonderful. It's also a really captivating read. He's an excellent author and writer. And also Jaws by Sandra Kahn would be another book that I'd recommend. Unfortunately, we have to empower ourselves sometimes with this. And I do recommend educating yourself so that you can be an advocate for your child and yourself, especially if you don't have providers in your area that know a lot about airway and sleep health.
Yeah, that's important. It is hard to find good providers. You really have to do some digging. But even in Oklahoma, I mean, there's people all around the country that are doing this work. So you might have to drive a little bit, which is good. So going back to how people breathe, and we should be able to, like you said, that practitioner in LA will have people breathe through their nose for 3 minutes and then characterize sleep disorder or breathing issues. A lot of people can't breathe through their nose. And so their response, and I've had this conversation with a lot of people, is, I couldn't imagine taping my mouth shut before I go to sleep, when we talk about mouth taping, because I can't breathe through my nose. So that's off the table for me. And to me, that's like saying, well, I can't even walk up a hill, so why would I exercise? It's like the fact that you can't walk up a hill without like falling over is the problem. So maybe let's speak to those people, because I think a lot of people do have a deviated septum or they have congestion. So why should someone ignore their chronically stuffed nose?
Yeah, that's all great points. And yes, the lip taping is something I'm a big fan of. And that is part of that 3-minute test, is to see if you are capable of lip taping or not through the night. Humans are obligate nasal breathers. We are meant to be nasal breathing. We always say, look toward nature for the answers, and you will see all animals breathe through their noses, unless, of course, like they're panting because they're hot, but primarily animals breathe through their nose. Humans are no different. And so chronic mouth breathing, it can increase your cavity risk. It changes the pH of the mouth. It changes your oral microbiome. It can change your gut microbiome as a result. That can change your immune health and how you're absorbing nutrients. But we also know cardiovascular disease, sleep apnea and cardiovascular disease, erectile dysfunction because of nitric oxide. All of these things, they add up over time. And so there are a lot of chronic downstream diseases because of chronic mouth breathing. So I highly recommend that you go and speak to someone about it. You know, a lot of times we'll hear in the news that someone maybe passed away, but people will say, well, they were so fit. They were an Ironman or they were a triathlete. And the first thing I'll say to my husband is, I wonder if they had sleep apnea, or did anyone check their periodontal health or their oral health? You know, these are things that get kind of pushed to the side or ignored, but we're trying to make them more mainstream, and how important sleep quality and how we're breathing. You know, we really say any amount of snoring is abnormal, unless of course you're sick, but that includes your child, you know. So your little baby snoring, although it might be cute, that is a sign there is some airway obstruction, and that something should be done. And that includes for your partner. I think we just kind of put up with it. We tolerate it. Common is not normal, you know, and so many people do have airway issues. So many people snore. That doesn't mean it's normal. So many people clench and grind. So many people wake up with migraines. That's not normal. And some of these things are because you're literally choking in your sleep. You're obstructing. So you are either clenching, grinding, moving your body, positioning yourself so you can breathe better, and that will add up over time. And so I really do suggest at least going for a consultation just so you can hear the information and see what options are available to you.
That's a really good point. And what about waking up in the middle of the night to urinate? I think a lot of people think, oh, I'm getting older, my prostate must be enlarged. But I do hear this from my female clients as well, as they're peri or post-menopause. They say, gosh, I just wake up at 2 a.m. And, you know, the hormone endocrine centric side of me thinks progesterone. But
Sure.
could it be the dearth of progesterone and the changes in estrogen are impacting maybe facial muscle structure or things like, is there a hormonal link with women waking up in the middle of the night?
There can be. I mean, definitely it affects cortisol. So when you are chronically obstructing in your sleep, you tend to be sympathetically overdriven. So there's a lot of fight or flight. You tend to have more anxiety and issues just settling at night. And so you're pulled out of your deeper sleep stages more easily. I do think sometimes waking up once a night to urinate can be normal. Everyone's different, right? We're bio-individual. But there is that I always wake up at 2 a.m. thing. And so I do think hormones, I agree with you. And so working with a hormone doctor on that. But yeah, there's a lot to it. And, you know, the thing I recommend too are sleep trackers. You know, I love Aura Ring. There's so many out there now, but unless you're really monitoring your sleep cycles, how do you know what's happening? So many people will say, oh yeah, my child sleeps great. They sleep 10 or 12 hours straight, or I sleep 8 hours straight. But what is the quality of the sleep? It's not only the quantity. So are you getting into your deep sleep stages? Are you getting into your REM stages? You know, this is where we have cleansing of our brain and our hormones are released, and we're really getting restorative quality sleep. So I don't necessarily mind that your child, it's important for me to know not only how long is your child staying in their bed, but what is the quality of their sleep too. And sleep studies are not extremely accurate in children. They're really only looking for sleep apnea per se, but now, you know, we know that it's really a continuum of some of these sleep disorders. There's sleep disordered breathing, there's upper airway resistance syndrome, there's just dysregulated breathing. And so I really like parents to go in and just observe their children sleeping. Listen to them. Are they snoring? Are they grinding? Are they noisy breathing, like the Darth Vader breathing? Are they tossing and turning? Do they have like really weird positions, like they're craning their neck? Do they spin around in their bed? Are they sleepwalking, sleep talking, prolonged nocturnal urenesis? Are they bedwetting past an age that's normal? These can all be signs that there is some sort of dysregulated breathing happening. And then certainly if you're starting to see behavioral issues during the day too, either whether it's like really they're waking up exhausted or they can't sit still, hyperactivity, focus issues, or teachers are saying they're having a hard time at school, I really would like to look back at their sleep instead of just saying, oh, that's just who they are, now let's medicate them.
Which is not good. Yeah. I mean, what's the long-term consequences of that? Like, where's the end game with just amphetamine use and things like that? I have noticed anecdotally with the children that my daughter associates with, the ones that are more hyperactive and like breaking stuff or knocking things over or whatever, they appear to be mouth breathers to me. And so and this is very anecdotal, I'm not a trained specialist in this way, but just observing the children and how they sit there with their mouth hanging open. So I can only imagine that there is some sort of element of sleep disorder breathing that is maybe impacting neurochemistry and causing more of a agitated type state throughout the day.
Fight or flight. Yeah, absolutely. Yeah, you can see it in their faces. Again, it's adenoid facies, or you can say it's like the allergic look. So it's, the kind of the droopy eyes. You can see more whites of the eyes underneath the iris. Venous pooling, which is dark circles, that has to do with inflammation and kind of blood flow, which is impacted by nitric oxide and also just mouth breathing leading to inflammation as well. And it's like you're shopping and you're in Target and you see the child having the temper tantrum, the full-blown meltdown, and the first thing I think is that child looks chronically exhausted to me. Like they need to be sleeping better. And we're so quick to judge other like parenting styles and things, but I think it's a big issue, and I think teachers out there listening are saying, yes, I see so many children with hyperactivity issues now. What is it? And of course it's multifactorial. It's our food, and it's the food dyes, and it's the sugar, and it's we're eating it's blood sugar dysregulation, but I think we're not talking enough about breathing and sleeping as well.
Yeah, really important stuff. Getting back to some of the toxins, you highlighted when we were in the sauna before recording fluoride, and how fluoride is in all the commercially treated water. This data has been sort of suppressed for a long time, some of the toxicity associated with that and reduction in IQ. What was the impetus to put fluoride in the water, and what are the potential harms of drinking unfiltered water?
Yeah, this is a big topic. So fluoride was initially, it was put in the water really based on observation of a dentist out of Colorado who noticed people in his community had fewer cavities. They had really mottled teeth, and in hindsight we know it was fluorosis, but they had fewer cavities, and so they kind of went with it, and they ended up putting it in the water in Michigan without really a lot of safety data, because again, it's the 40s. Okay, so it's just sort of been grandfathered in as a public health movement because cavities were skyrocketing. But what really were causing the cavities, I would argue, it was our food, our ultra processed food, our sugary foods, our milled flours, refined flours, and how we're breathing. So it really was a Band-Aid approach. But now more and more data has come out showing that it has some neurotoxicity effects. And it really is, fluoride's really defined as a neurotoxin. And so this is really controversial, and people get really heated up about it. But I do think to do no harm, we need to be looking at the data. And so there's now over 70 studies that are showing that by intaking too much fluoride in pregnancy and in infancy and early childhood, it can impact the IQ of children and their neurodevelopment. And it can affect, particularly boys, up to 5 IQ points, which doesn't sound like a lot, but it's actually on par with lead. And again, this is water fluoridation. So we also know through the research, fluoride really works topically, not systemically. And I will say, only 3% of Europe currently fluoridates their water. So 97% of European countries do not. Many of them have removed it from their water long ago for various reasons. One, the neurotoxicity concerns, but also the medical ethical concerns. We really are mass medicating people without their consent. And so I do realize the public health concern, but I would argue those who are talking about removing fluoride from the water, they're coming from a good place too, speaking of the public health concern about brain development in children. And some of the people who are exposed to fluoride in their water are some of the more vulnerable populations already, because they can't afford water filters. They can't afford bottled water. And so it's really hard to titrate or calculate the concentration and the dose that you're getting through water fluoridation. So, you may drink a glass of water a day, and I might be an elite athlete and drink 5 liters a day. And so I'm obviously getting way more fluoride in my system. And then let's take into account children. right, and body weight. And then infants who are drinking formula made with fluoridated water. So it just, to me, seems like a really archaic, antiquated practice. There is a federal lawsuit right now out of San Francisco. It's essentially the people versus the EPA. We're still waiting for the ruling, but just a couple weeks ago, there was a report that was released that had been withheld from the Health and Human Services Department. And it was a toxicology report from the National Toxicology Program, I think it's the NTP. And basically it showed, they did a meta-analysis over the past 6 years of research, and I believe it was 52 of 55 studies were showing a positive correlation between IQ and neurodevelopmental issues with water fluoridation, or too much intake of fluoride in pregnancy. And they were really high quality studies. And so at the very least, I just think we should be taking a pause and having professional and calm conversations for the betterment of human population. Because at the end of the day, fluoride really is a Band-Aid. And the root cause of cavities is what we're eating and how we're breathing. It's not lack of fluoride. You know, fluoride's not an essential nutrient. No one's fluoride deficient. And also fluoride works topically. So if people want to use fluoride, I suggest just using it in toothpaste, just getting the varnish done at the dentist. But even better than that is something called hydroxyapatite, which is something I'm a big fan of. It is what is in our enamel. It's basically a calcium phosphorus crystalline structure that makes up our enamel and our bone. And so it's biomimetic. We have no fluoride normally in our bodies. And so that is what I suggest for patients right now, because there is no poison control label on it. It's safe to swallow. It's safe to use in children. There's been some talk about nanohydroxyapatite particles. The SCCS out of the EU is looking at nanoparticles in cosmetics. And so there are some rules and regulations about nanohydroxyapatite, which is great. We want rules and regulations. Sure. But I will tell you, clinically, it's extremely effective for remineralizing, and I'm much less worried about the neurotoxicity in children. You know, when a parent comes and talks to me in my office about my thoughts with fluoride, I simply say, I can't look you in the eye and say confidently, I think it's completely safe for your child. Because children are swallowing their toothpaste and it is absorbed through the oral mucosa. And somebody might just use a smear of toothpaste or a pea-sized amount, and others are using a huge glob of it, and they're doing it 3 times a day. Plus it's in pharmaceuticals, plus it's in our water, plus it's in tea and ultra-processed foods, especially beverages. So we're just getting too much of it. We've kind of gone fluoride crazy. And what are the risks of this? And so the lawsuit in San Francisco is interesting because it's one of the first times a judge he's basically said, I don't really want to hear from the dentists. I really don't want to hear from the American Dental Association per se. I want to hear from epidemiologists and biochemists and neuroscientists. And so there's a lot of really captivating expert testimonials that is not looking good for water fluoridation. So we'll see how he rules. It is federal. So, I mean, if he rules in favor of removing it from the water, we'll see what happens with that. But I'm fluoride cautious is what I would say. And I choose not to use it in my family. Good. Because we're also really strict, if you will, with our diet. You know, we're not eating a lot of ultra processed foods and crackers and pretzels and chips and granola bars and fruit snacks and all of these things that I think a lot of families don't realize can contribute to the cavity crisis. I will also say cavities are still the #1 chronic disease globally, especially in children, and they are a disease. It's a bacterial infection, and this is even with fluoride. So we're seeing cavities decrease globally, whether a community is fluoridated or not. And so the proponents of water fluoridation will cite that, saying, well, look at water fluoridation, you know, cavities are decreasing. But here's the thing, cavities are decreasing anyway. And we see that in other countries. And I think a lot of it is because we are more aware of, oh, soda causes cavities. Oh, candy bars cause cavities. So our diets are cleaning up somewhat. And people are seeing the dentist more regularly, and they're more they're more likely to have a better oral hygiene routine than we did back in the 1940s per se. So, you know, correlation's not causation. And so I'm just keeping a close eye on it, but I'm not a fan of water fluoridation.
Yeah. So most of the proponents, are they dental professionals, or are these activists within the community as well?
I'd say they're most dental professionals. Yeah.
Which is quite interesting because, with all due respect to the dental professionals, the more cavities people have, the more income they get.
Business,
right. So it's like, it seems kind of counterintuitive insofar as they would almost even want less. Are they that altruistic that they really want everyone?
I think so. I do think so. Yeah. I mean, I will tell you, I have plenty of families who still use fluoride in my practice, and their kids are still getting cavities.
Right.
And so we're seeing more under mineralized enamel. What is that from? I theorize with others. It's magnesium deficiency, vitamin D deficiency, you know, how our nutrients are becoming bioavailable based on microbiome, gut imbalances. It's very nuanced. So I see plenty of cavities even in kids that are using fluoride or drinking fluoridated water. But yeah, I think these dentists, their hearts are in the right place. I would argue they're not very good at reading research without a bias, because the research it's there. And I say this on my platform. I like everyone to know I was a dentist who promoted fluoride. I was taught and trained very conventionally, and it was up for vote in Portland. It was over 10 years ago, and I was on the basically pro-fluoride campaign, and I was picketing and wore the buttons and all the swag and everything. And why was that? It's really because I hadn't done the work, and I was just taking information that had been fed to me in dental school without ever questioning it, without ever looking at the other side or what the controversy was. And I would become very impassioned about this. Like, fluoride is saving lives, you know? But then I went to a debate, and I remember hearing the opponents, and things had been brought up to me that I had never heard before in dental school. Never had I heard about neurotoxicity, and how this was impacting our children. And so it really made me take a step back and look big picture. And then I personally started digging into the research, and sitting down and reading with it. And I'm an N of one, but I will tell you, when I speak to some of my friends and colleagues who are dentists about this, they've really read none of the research. They haven't even thought about fluoride since dental school, which maybe was 10, 20, 30 years ago. And so science changes, you know, and it's constantly in flux, and that's a beautiful thing. And so I think we need to at times swallow our pride. We are healthcare providers. We are do no harm providers. We are here to help the betterment of humans. And so that means being open-minded to some of the new research. But, you know, I think both sides feel they're in the right, but we'll see what the judge has to say from this federal case.
Super fascinating. I'll definitely be watching this story more closely. Yeah. I think it's interesting. And I love when people change their mind based upon new data, you know, and I feel like a lot of, our minds are very cognitively biased, and we want to seek out things that prove our biases right. Absolutely. Most of the time. And so having an open mind and just questioning, well, we could be wrong. Like, we could be wrong on this topic, and do some more research. And oftentimes people are blown away by what is out there. So hearing both sides of the story on any topic, I think is really important, especially a controversial one.
And just think how many other medications we've been wrong about. Like, okay, it helps with high blood pressure, but it also is causing suicidal tendencies, or, you know, whatever it is. It's just so interesting to me with fluoride in particular. It's just such a hot topic. I mean, people get fired up about it. Mm-hmm. And I wish we could just look at the data with an unbiased mind. That's all I ask of everyone.
I like that. And also there's a new, not to transition too much, but just a small tangent about toxicology. I think that the toxicologic model is changing. It used to be the dogma was the dose makes the poison, but now we are exposed to all sorts of different, the synergistic effects.
Gray barrel effect.
Yeah, I mean, from chloride and bromine in the pools, and then the fluoride, and then also the nonlinear effects that these toxins have insofar as, you know, there can be nonlinear pharmacokinetics, like low doses, because they're not bound to albumin and sex hormone binding globulin like other hormones. So talking about persistent organic pollutants or their perfluoro compounds in cookware and flame retardant. So these things are everywhere. And so I think it is important for parents to recognize that, part of a good health or a good healthy family is filtering your water,
I totally agree. And we're all bio-individual. And so some of the newer research was looking at moms who are iodine deficient and how that really exacerbated their fluoride toxicity levels, essentially. And then patients with MTHFR, methylation issues, it's not so simple. We're oversimplifying humans, I think. We're very complicated. And so what might be fine in one patient may not in another. And I just think we need to be digging a little bit deeper to your point about how things are interacting and that rain barrel effect, as I mentioned. I mean, things do accumulate over time. Toxins do accumulate. Heavy metals do accumulate. Yes, the body's very good at detoxifying until it's not, and when does that happen? We don't know. It's different for everyone, but I'm a big advocate of trying to avoid as many environmental toxins as possible.
Yeah, especially in children.
Especially in children. They're so vulnerable with their developing brains. Yes.
Yeah, I love that. Getting back to the airway, and if someone is having sleep disorder breathing or they're mostly mouth breathing, how is that impacting? You mentioned that increases your risk for cavities. Yeah. So my suspicion is that it's changing the oral microbiome ecology in the mouth, and that presumably has consequences for the gut microbiome as well. So I was just kind of curious on how that whole process works.
Yeah. So there is something now that we're talking about the gut, the oral gut access. So when you breathe through your mouth, the pH drops into a more acidic environment, and that's a perfect breeding ground for anaerobic bacteria, and those are the bad guys. So pathogenic bacteria. It also dries out the mouth, and so saliva is very protective of our teeth for many reasons, but it contains nutrients and just the moisture itself and enzymes and things that just really protect your enamel. So you're drying out the mouth, the pH is dropped, so it's more acidic, so you're more prone to cavities, absolutely. But then that bacteria, if you have more pathogens in your mouth, you do swallow 2,000 times a day, and that is seeding your gut microbiome. And there's more research. It's kind of a cool time because this is, the oral microbiome is just really hot and fresh right now, but that is impacting gut health. Some of those microbes do live through the hydrochloric acid. They get down into the small and large intestine. What are they doing down there, and how are they interacting? We're still learning a lot about that, but we do know too that, how we absorb our nutrients in our gut, that is then incorporated back into our saliva, which is then feeding the microbiome again. So it's a very circular system. And so it's something we shouldn't take for granted. And then also what I'm very interested in is how the oral microbiome is impacting other areas of our systemic health, whether that be Alzheimer's, cardiovascular disease, autoimmune diseases, and fertility is a real hot one right now. So the list goes on. And I think a lot of patients don't realize how their oral health can lead to some of these downstream diseases if it's left in dysbiosis or imbalance.
That topic is so fascinating to me. There was a paper, I want to say in 2013 or 2012, that showed that the bacterial fragments from individuals who had periodontal disease were also found in the plaque in the brain, like the beta amyloid. So how is it that these bacteria in the mouth are then somehow getting into the brain? Is it like we talk about leaky gut, is it like a leaky periodont, leaky gums?
So we've coined it leaky gums. They found P. gingivalis in the brain, which has no business being in your brain. It's really specific to the mouth. And this is in Alzheimer's patients. I believe if you have periodontal disease, you're up to 80% more likely to have Alzheimer's. So it's a significant tie there. These bacteria, they're releasing exotoxins and lipopolysaccharides and byproducts that are damaging. They're traveling through the bloodstream, they're traveling through the lymphatic system, but they actually can travel along our nervous system too, including our trigeminal nerves and our olfactory nerves, and they're crossing the blood-brain barrier. And so that's kind of scary stuff, so what happens in the mouth doesn't stay in the mouth. And so these bacteria, they can go everywhere, and not only them physically, but their byproducts. And so unfortunately, medicine and dentistry, they separated long ago. And so we've compartmentalized the mouth to think it's a separate entity. But what's cool about the mouth is we can see what's happening in there. And it really is a gateway into the body. And so I can easily look at a patient's mouth, and sometimes I can see if they have nutritional imbalances, zinc deficiency, vitamin C deficiency, B vitamin deficiencies. I can tell their hydration levels. I can tell their gut health sometimes by how their tongue will look. We can see diabetes. We can see protein deficiencies. I mean, it's pretty cool stuff. And then, so if you have cavities too, you know, that is a sign that there is some malnutrition. There's some nutritional deficiencies or microbiome deficiencies or imbalances. And I really do believe you cannot have a healthy mouth without a healthy gut, and you cannot have a healthy gut without a healthy mouth. It's very bidirectional. But for me personally, you know, what made me prioritize my oral health was that Alzheimer's connection. Others, you know, are like a lot of men are motivated by erectile dysfunction, discussion, and periodontal disease. Fertility is a big one. You know, couples that are really struggling. It's not just the women either; it's the men as well. Making sure that your gum health is optimal. You're seeing the dentist regularly, your hygiene's on par. That can increase. I think women with gum disease, periodontal disease, they can take 2 or 3 more extra months to conceive. So that's a big deal. And with men, periodontal disease can affect sperm mobility and sperm motility. It can affect hormone release in women as well. So I hope more fertility docs are sending their patients to their dentist. And the same goes for like diabetic patients too. If we can clean up their periodontal disease and gum disease, we can get more blood sugar stability too. So we're trying to work with more functional medicine providers to just say we need to work collaboratively for patients, and we can't forget about the mouth.
That is so important. I think many people gloss over that fact. And just because I like mechanisms, is it postulated, what is the mechanism with periodontal disease and gum disease and infertility and low sperm motility? Is it the chronic inflammation that's Okay.
Yeah, chronic inflammation. It does affect luteinizing hormone and gonadotropic hormone
releasing
too.
Hormone.
Yeah, releasing hormone as well with women. And so in their ovulation cycle. But we theorize too it's the exotoxins as well, and that low grade systemic inflammation.
This is really important because if someone goes to a fertility doctor and does rounds of treatment with HCG and all these other things, we're talking $30,000, $40,000. Going to the dentist at most, maybe for a cleaning, is probably $300 on the higher end. So to me, it makes more it's much more cost effective to at least start there. Yeah. Rule all that stuff out. Yeah. Then, you know, figure out these other things.
And go in every 3 months for cleanings too, like really get things cleaned up. You know, I think a lot of people don't realize as well that we are exchanging bacteria constantly. So there's a joke, like, you know, when you fall in love with your partner, you're falling in love with their bacteria too. But a lot of people don't realize that we transmit our bacteria to our loved ones, including our children. And so if you do have active gum disease, periodontal disease, or cavities that are untreated, please take caution in exchanging your kissing and, you know, sharing utensils and things with your partners or your children, because you're inoculating them with some of these pathogenic bacteria potentially. So there's oral microbiome testing now, which is really cool. I'm starting to test kids. There's a take-home test for at-home use that so patients can use. It's called Bristle. And, you know, we know there's over 700 species of bacteria that we've identified to date. How are they all interacting with each other? We aren't totally sure, but we're unpacking a lot of that. But we're creating more bio-individualized protocols. So, you know, depending on what bacteria you have and how virulent they are, it can change what you might need. So if you have really virulent anaerobic bacteria, you might need antibiotics, or you might need certain rinses and specific toothpaste and specific nutrients like L-arginine and nitrate, you know, rich foods and more prebiotic fibers. So we're really trying to tailor recommendations to patients now based on oral microbiome testing instead of just saying brush, floss, and don't eat candy bars and see me in 6 months, you know? So it's kind of cool, the more bio-individualized medicine that's happening. But the fertility thing I think is really fascinating, and that it is impacting not just the female, but men are involved too, of course.
Right.
It's two to tango. So yeah.
Well, and two to tango, you know, with sharing the bacteria. That's really interesting.
Yeah.
I mean, I think a lot of people, you know, that are dating and stuff like that, they're worried about AIDS and syphilis and, you know, herpes, but now you're introducing the idea that you're swapping bacteria.
What's
so
your oral microbiome like?
Wow.
Yeah.
That is super interesting
Yeah.
and scary at the same time, you know?
Yeah. I mean, we don't want to overthink it,
Right.
but, you know, I don't anticipate people will be out like handing out oral microbiome tests before they go on their second date. But, you know,
Yeah, never know.
it's good to think about.
Health people. Yeah, no, I think it totally is. That's really fascinating. So the bacteria is so connected to systemic health, the brain. Now, can you get rid of, so periodically the holistic dentist that I go to, and I've sent friends and clients there and so forth, they'll do just a quick swab and then put it under the microscope to look at the ecology. And sometimes I have spirochetes, but other times I don't. And I wonder if that's inside out thing. Like if my immune system is stressed, then maybe the spirochetes come out. If they're not, or could it be that they're there and not visible? And if I know you mentioned something about spirochetes and your tonsils. So what is the problem with spirochetes?
Yeah, they're nasty. They're like little corkscrew shaped bacteria that can really implant deep into your tissue and can be hard to get rid of. I like that you just said this though. So our oral microbiome is constantly changing. And why is that? Well, every time we eat something, every time we drink something, every time we kiss someone, every time we put our bite our fingernails, kids putting things in their mouths, we're introducing different bacteria. If you have a new filling, if you have braces, Invisalign, it's all changing the microbiome. So it's very transient. And so that may be why sometimes you see spirochetes and sometimes you don't. But also, yes, maybe your body is fighting it off. Maybe you reintroduced it somehow from someone in your environment. It's really hard to say. But spirochetes are some of the bacteria that often will need antibiotics to treat. You know, I had chronically infected tonsils. I was injecting them with ozone, which helped temporarily. And ozone's really cool in dentistry too, to help with periodontal disease and gum disease and cavities. And I use it in my office, and it's one of the most wonderful things I've added. But it can only do so much to these virulent bacteria that are buried deep, deep within tissue. And that's sometimes where we do need to attack things more systemically. And that might be where antibiotics come in. And that's where we need to test, because how else would we know? And so more progressive dentists are doing oral microbiome testing. We're doing blood sugar assessments. We're testing vitamin D, sometimes oat testing, you know, organic acid, micronutrient testing, and certainly like a GI map too. So it's kind of cool that dentistry is changing. I think we're always going to have a place and a need for more tooth technicians, like people that actually fix teeth. But I'm excited for the field of more tooth physicians, you know, like physicians of the mouth, if you will, and really trying to unpack things on a deeper level for patients.
That's awesome. I love that. So ideally, how often should someone get teeth cleaning, right? Let's say someone's oral health is okay. They floss, they brush, etc. Twice a year. I mean, my dentist recommends, I think, 3 times a year. They're more holistically inclined. Yeah. I was thinking, well, that's a little overkill. I'm just doing twice. I used to, but what, you know, because they do like deep cleaning, all sorts of stuff, right? What's ideal?
It depends on the person and their needs. So the every 6 month thing was really created from the insurance companies. So insurance companies will pay for twice a year cleanings generally. And so that's where it's come from. That is unfortunately where many protocols in dentistry have come from, including x-ray frequency. It's a bummer that we're being, you know, we're following the rules of insurance companies. So it really depends. You know, if you have more gum disease or periodontal disease, yeah, you should go in more frequently, at least until the disease is stabilized. If you have optimal gum health and dental health, I think sometimes you can go every 1 year or so. It depends on your diet. So if you're eating more paleo or carnivore, you are probably going to have less plaque and biofilm accumulation. You know, the anaerobic bacteria in our mouths, they really love fermentable carbohydrates, which again are the crackers and the pretzels and the chips and the granola bars and the ultra processed foods. So think flour. We all know sugar, but think flour also. So, refined flour in the mouth, it really acts a lot like sugar. The bacteria love it. So it depends. It depends on your gut health and your nutritional status too. But I go every 6 months when I get around to it. I'm like the worst patient because, I'm always at my office, but.
Right. You're like, I don't have time to do this.
Yeah.
That is so funny. So let's talk about do's and don'ts. I see a lot of people that are drinking, and I like kombucha. I think we all like.
Yeah.
How hard is that on the teeth? And if you do drink kombucha, how should you drink it?
Yeah. Kombucha has a lot of sugar in it, and it's pretty acidic. So you want to be careful with it. I think we've gone a little overboard with it. People are drinking huge containers of it. You don't really need a lot for the gut health benefit. If you're going to drink it, I wouldn't sip on it all day. Contact and duration in the mouth matters. So people who, let's say they sip on their kombucha for like hours and hours, they're very likely to have more erosion or even risk for decay as opposed to drinking it all very quickly in one sitting. So I would just drink a small amount. You could use a straw. And I might not do it all day every day. You just want to be careful. It's a treat. Yeah, I'm a big fan of water with electrolytes, right? But yeah, I think we've gone a little overboard. And I think people don't realize how much sugar is in some of the brands, so definitely look at the label on the back to see how much sugar there is. So those would be don'ts. I mean, people sucking on lemons, please don't do that. Lemon water I like, especially to help with digestion. Again, short and sweet, just kind of like down the hatch, kick it back quickly or use a straw. You can then rinse with just plain water after, or extra credit is to do a little baking soda rinse because that will buffer or neutralize. I'm a big fan of baking soda rinses. That can help with like yeast, candida too.
Okay.
Candida is highly linked to cavities as well. And there's a lot that are theorizing when we see people call it, early childhood cavities, or, people are blaming breastfeeding for cavities. That's a whole other topic I can get going on. But it's candida most likely, as well as like undermineralized teeth. I personally think is a silent epidemic happening globally from, as I mentioned, maybe microbiome imbalances, but nutrient deficiencies too that we're seeing. Yeah.
And that's where the toothpaste that are enriched in hydroxyapatite come in to help with that.
It can help. The bummer is some of these these babies are being born, their teeth are erupting and they're just crumbling. I mean, it's really devastating. It should be discussed more. I feel like every anesthesia case I have to do now, the kids have hypoplastic or undermineralized teeth. And so the parents are getting blamed for not having optimal hygiene or giving their kids terrible foods. And a lot of these families are doing everything correctly. It's just the way the teeth developed in utero and after. And that can be because of absorption issues and just bioavailability. It could be the maternal gut health, the mom's microbiome. So many women, so many humans are vitamin D deficient, magnesium deficient, K2 deficient, fat soluble vitamins really make a big difference. So, but yeah, candida is pretty prominent issue, but you can do baking soda rinses if you're having something more acidic. Soda water too, be real careful with some of the sparkling waters. It's the carbonation as well. So I think it's a fun treat, but I really like just plain water or plain milk if you're giving your child something.
That's a really good tip. So the children with undermineralized teeth, is there a correlation with vegan and vegetarian diets? I know this gets really controversial, but like we just got to share the facts here. Yeah. So
I have not seen any data on this because I don't think the research has occurred. I would love for this study to happen. I've even thought of doing some case studies, pulling just data at my office, and it's one of those things I mean to get around to. My N of 1 observation, being a dentist for almost 18 years now, is yes, I do see a lot more undermineralized enamel and deficiencies in children whose moms were vegan while they were pregnant, and even worse if they're being raised vegan as children. It is controversial, and can you eat a vegan diet and be optimal? I think you probably could, but I think it takes an incredible amount of work. I personally was vegan for a few years. It was, again, my experience, but I was really depleted and felt like garbage. But that being said, I just think there's so much vitamin D deficiency and micronutrient deficiency and B vitamin and protein deficiency in vegans and vegetarians. And so I would encourage you to consider adding animal products if you're pregnant, at least just for dental development for your children. That's what I'm seeing.
That's a good tip.
Yeah.
It's an interesting argument, and it's become even more politicized now. And like the extremes are getting even more extreme, right? And so trying to get people to see some middle ground or eat some meat periodically or a couple, it's really an interesting conversation.
It is. It's hard because there's ethical, spiritual reasons for it. But to your point, I'm just stating my clinical observation.
Yeah.
I do have a very busy practice. I have about 4,000 active patients. So I see them, let's say, twice a year. So I see 8,000 patients a year. It's a lot.
Yeah. And being in Portland, there's probably a high prevalence that are vegan or have been vegetarian for a while.
But what's interesting is I find more and more of them are starting to eat animal products again. So, that's just my observation, but I think we're realizing how challenging it can be to get some of the essential nutrients from strictly vegan diet. And I just think more parents are open to at least everyone wants what's best for their children, right? And so more parents are being open to, okay, well, these are my spiritual beliefs, but at least during pregnancy, I will try to incorporate more animal products. And then maybe I'll go back to that dietary choice and lifestyle after my child's born.
That's a nice happy medium for folks.
So.
I like that.
So, yeah.
That's cool. Okay, we have tongue scraping. I've been doing that for quite some time. Great. I like it. I feel like it's not mainstream enough.
I agree.
What are the benefits of that?
Yeah, I'm a big tongue scrape fan. You can remove bacteria from your tongue and food particles. And it can help improve how you taste food, which is kind of cool. You can overdo it. So we have a lot of nitrate-producing bacteria that live on the dorsum of our tongue, and they're really important for nitric oxide production. So you don't want to, just like anything, you don't want to overdo it. But I do like it. It's a pretty, it's Ayurvedic practice. People always ask the order to do things in. I generally just tongue scrape once a day. I tend to do it at night. There's no data to support this. It's like personal preference, but I will usually tongue scrape and then floss and then brush. That's what I do. I will say I'm a big fan of flossing. Please floss. 30% of your tooth surfaces are the in-between ones. It is where we see a majority of cavities in children and adults for that matter. And it will help prevent leaky gums, as we mentioned. So leaky gums, I'll go back to that. Just like we have leaky gut, leaky gums are when your gums bleed. So now there is a vector, a pathway for bacteria in the mouth to get into the bloodstream, into the lymphatic system, into your body essentially. And it's a barrier for immune health. We want that to be a nice strong barrier. And so please floss your teeth. That's all I can say. There's some people on social media I've seen saying, it
doesn't work.
Or it's ancestral purists that are saying, well, we didn't used to brush and floss.
Yeah.
But I will argue our microbiomes are different. And they've done testing they test like the tartar or the calcified plaque of ancestral specimens. And our biomes have changed, for better or for worse. And so I think to err on the side of caution, just please don't be extreme that way. Just floss your teeth. I can tell you clinically, patients who floss are much healthier.
Right. And it's not causing any harm, right?
No.
I mean, so you have to look at risk and benefit, right?
For sure.
So
yeah, I mean, there's something called iatrogenic damage if you're flossing incorrectly. You'd really have to be flossing pretty aggressively. So if you feel you don't know how to floss, ask your dental provider to show you. Or if you have too hard of a time with it, you can use water picks, which I'm a fan of too. Like water flossers can work really well as well.
I've been putting a little sea salt in mine.
Awesome.
Is there any added benefit with the sea salt in the water pick?
Well, yeah. I mean, salt is antiseptic, so that's helping. You could sprinkle some baking soda in too. I really like baking soda and salt rinses. Save your money on all the fancy schmancy rinses. You know, so many of those rinses, they're antimicrobial. They have dyes in them. They have really strong essential oils, and they're very damaging to our delicate oral microbiomes. There's studies that are showing it can impact, you know, your blood pressure, increase blood pressure, because it's damaging those nitrate producing bacteria that's affecting nitric oxide production, which can affect cardiovascular health. So there's downstream effects to like the Listerine. So I say skip it.
Mm-hmm. Yeah, I've heard that. I mean, there's alcohol in there too, right?
Yes.
I mean,
yeah. So drying and not good.
It's crazy. When it comes to toxicity, I mean, going to the toothpaste department in like Walgreens or, you know, the mouthwashes and the just the toothpaste, like it's a lot of stuff that's not healthy for you.
No, less is more. It makes a ton of money, right? It's $1 billion industry. So we're the whole concept that we need to disinfect the mouth is wrong. You know, I think we're learning this, like the hand sanitizer and the bleaching, everything, like that's not good. Allergies are up in kids, eczema, psoriasis, asthma. We need to nourish our microbes and our microbiome. We are more microbial cells than we are human cells. And that's really important. They're so impactful in our health. And so this carpet bombing of our mouths through all of these agents is not the way to go. Mm-hmm. You know, you really want to be using as clean products as possible with the fewest ingredients, just like how we're looking at our food too. Yeah. Less is more. And there aren't many great choices out there. I'm going to be honest. I think there's good choices, but I don't think there's much that's really perfect on the market yet.
Right. Okay. Controversial question, but what are face masks doing to the oral microbiome and mouth breathing?
That's interesting. You know what? The first thing I think of when patients have come in, or I've heard people have a hard time with masks, is I think you're a mouth breather. Mm. So I've had to wear a mask most of my working day for 18 years, and I do okay with it. I have to think about my tongue position and lip closure, but patients who really have had a hard time with it, I wonder if you're a mouth breather. So that's interesting. But if you are chronically mouth breathing, yes, that's not great for us. That's drying out the mouth, it's increasing cavities. I haven't seen a lot of data on it, but I do think it's exacerbating or pointing out probably underlying issues that maybe weren't noticed before. Okay. That would be my take on that. I'm happy that we're not having to wear them all the time anymore. Yeah, right. That's exciting. So yeah. But if you are someone that can't put a mask on your face without ripping it off, I do wonder, are you able to breathe through your nose comfortably? And you should do that 3-minute test to see what happens when you do breathe through your nose, timed, and maybe play around with lip taping a little bit too. Mm-hmm. Yeah.
Amazing. Bentonite clay. We haven't talked about that yet. I know you're a fan of that.
I do like it. It's very controversial. Well, I shouldn't say it's very controversial. There's a lot of purists out there that talk about, the trace amounts of like heavy metals or lead in some clays. I do think some clays are cleaner than others, but bentonite clay has been around for a long time. And it does have a lot of benefits for remineralization and stabilizing the microbiome. So I personally use it. I always want to get third-party testing on it and things of that nature. But I'm a fan of bentonite clay. I use it for masks and facials and things too. As well. Yeah.
So it works sort of like the hydroxyapatite, but does it help with the cleansing too of like coffee stains?
Yeah, it can. Both? Yeah, it can. It can be a mild abrasive. It can pull out stains. Some people use charcoal for that too. Be a little careful with charcoal, please, because it can be overly abrasive. Bentonite clay is a lot milder, and there's a lot of minerals and things in it too. So and it can be like a carrying agent too in a paste. Some people use it instead of glycerin. And so there's some internet rumors going around like glycerin inhibits remineralization. It creates like a coating on the teeth to inhibit the calcium and phosphorus absorption. There's no data to support that. So they keep saying this. I don't love glycerin. I don't think it's really necessary because I worry what it's doing to the microbiome. So some people are using bentonite clay instead, but for the actual remineralization purposes, I don't really have concerns with glycerin for that reason.
Okay. So the bentonite clay, should that be an everyday thing, or is this like a 3-day-a-week toothpaste?
You could use it every day.
Okay.
You could use it every day. Yeah.
Gotcha. Love it. Now you're working on a dental floss that's sustainable, packaged, and compostable. Tell us more about that.
Yeah. Happy Floss. It's been a labor of love. I got the idea. I was walking on a beach in Hawaii and noticed on the shoreline all this trash and all this plastic. And I looked closer, and there happened to be all these flossers and floss picks. And it was sort of around the time when the big plastic straw movement was happening, and more people were using paper straws. And I thought, well, gosh, why aren't there paper flossers? And then I started looking into it more, and I realized why. They're really hard to manufacture. So, but I did create a prototype, and we have patents pending about Happy Floss. And so I'm just, the heavy lift is the manufacturing partners right now. So we're trying to get that off and running, but they are truly compostable. There's no PFAS and no Teflon, and they're really clean. It's made with BioSilk. And they can break down in a compost bin in under 6 months.
Wow.
So no microplastics. That's the hard part with many of these floss picks that you might be seeing on the market. They say they're biodegradable or compostable. Bioplastic really isn't the answer. Most of them are still mixed with petroleum-based plastic. I don't think the average consumer knows that. So 50 to 90% of the bioplastics used right now still have a petroleum-based plastic. And so some of the sustainability experts I speak to, they think bioplastic is worse for the environment because it breaks down faster, but that means it's releasing microplastics into the environment faster because there's still petroleum-based plastic there. So just a little greenwashing that might be happening. I think there's some cool things happening with algae and used as a bioplastic source, but we're really far away from that being
I've heard hemp too, even.
Yeah. Yep. We'll figure it out, I think, but eventually. But for now, I mean, my floss is made of post-consumer recycled paper, and it's kind of it fully breaks down into organic material, which is kind of
awesome.
Cool. Yeah.
That's so cool. Yeah. I mean, it's talk about single use, right? You're using it once and throwing it away. So like that is like the best case scenario for something. I mean, I worry about dietary supplements, but that's lasting a month, right? So it's like 1 bottle per month, but every single day you add that up over a lifetime, you're looking at a pound, like tons of this.
Oh, it's so many. And some people use more than one floss pick a day. Some people use several. And then I hear a lot, well, just use regular floss or just use water flossers. Well, not everyone can. And if you're flossing your children's teeth, I will tell you the only way you're going to get that done is with a floss pick. Initially, I do like parents to start flossing their kids' teeth around 2 or 2.5. It's when all the molars are in and they start touching. That is where every dentist on this planet sees cavities in children the most. It's between the back molars. So I can't overemphasize that. And then, some special needs patients or patients that maybe have like arthritis or, there's a lot of variables that go into how a patient can get some of these routines done. And I'll tell you too, water flossers, I mean, where does that go when it's done? That's going into a landfill and there's a battery there. And so it's not a perfect solution either. So, I think things that can break down into organic matter.
It's awesome.
That's where I think the industry should be moving toward. Yeah,
that's a game changer. Amazing. So I know you share a lot on Instagram and so forth. So if folks want to connect with you, what's the best way to do that?
Yeah. So I am on Instagram it's Dr._Staci. It's DOCTOR_STACI. I have a website, drstaci.com. If you want to see me in person, I'm in Portland, Oregon, in North Portland. So it's called NOPO Kids, NOPO Kids Dentistry. And we do have families that travel from all over the country. And actually, we have other countries represented too. So it's just very flattering. I'm on TikTok.
Nice. How's that going?
Sort of.
Yeah. Are the templates cool for making like you can like put a study and then you can do the green screen thing?
That is much easier. I will say the editing is a lot easier.
Okay.
Because I do like it for that. So it's not my vibe per se, but it's the same as Dr._Staci. So
Nice.
yeah, and I have some exciting announcements this year. So follow along for more. I'm trying to get more into offering courses and guides and more education for parents, because I know some of you don't have a functional pediatric dentist near you. We're pretty few and far between right now. So I'm trying to offer more resources for people to feel empowered.
That's awesome. And then it just saved time when seeking out practitioners or what have you. And then even helping the healthcare practitioners, because there's so many people with blood sugar issues and diabetes and all that. And, you know, they're probably on metformin or they're doing this or that, but you're like, what about their oral microbiome?
Yeah.
So,
yes, exactly. And how bidirectional that is with diabetes too. I mean, that's a big one. So we could go on and on about the oral microbiome.
it's amazing. Well, I really appreciate you coming on the show, sharing all
Thank
your
you,
wisdom.
Mike. Yeah.
It was fun to sauna with you, and you went in the cold plunge for a good minute, which is fantastic.
Yeah, bring it.
Awesome. All right. Appreciate you coming on.
Thank you. Pleasure.